Hello guys, it's Dr. Ursula Falkringe here again. I have a question to you. Did you sleep well last night and woke up rested and full of energy? Or did you wake up with dull headache, facial pain or fatigue? If so, it could be a sign of bruxism, and that is teeth grinding, which is a common condition with a prevalence of up to 31% in the American population. Bruxism is when a person clenches or grinding their teeth, often during the sleep and often not being aware of the problem, except for the discomfort the habit is resulting in. Teeth grinding can have far-reaching symptoms, and the root cause may not be obvious. The American Dental Association reports that some common symptoms include waking up with dull headaches, jaw sorenesses, facial pain, fatigue from lack of sleep, pain or even loose teeth, and fractured teeth. The good thing is that most cases of bruxism can easily be treated by wearing a night guard for teeth while you sleep. Night guards for teeth are also known as dental guards, mouth guards, nocturnal bite plates, or bite splints. They work by putting a barrier between your teeth. When you clench your jaw, the night guard for teeth helps to lighten the tension and give cushion to muscle in the jaw. This cushion not only helps to prevent face and jaw pain, but also protect the enamel of your teeth. You can actually, by grinding, fracture your teeth quite badly, could even lead to lose a tooth. Night guards for teeth can be purchased over the counter without a prescription, as well as straight from the dentist or cost efficiently from an online retailer. There are a few different ways they can be fitted, and the type that will work best for you depends on your individual needs. So there are soft night guards. This is the most common used type of night guards in States for teeth to treat bruxism, and used mostly for mild cases. It is not for the severe teeth grinders. There is another type of night guards, dual laminate night guards. This type of night guards for teeth to treat bruxism is for moderately severe teeth grinders, and they are soft on the inside and hard on the outside. And there is a hard night guards, and they are for treat bruxism for more severe cases or even TMG problems. That kind of night guards is made of acrylic. They are hard and extremely rigid and durable. Fitting your night guards for teeth can be done in different ways. Personalizing the fit of your night guard will depend on what brand you choose. Many of them use the same process that is used for snoring appliances. The different types of fitting them are one size fits all. They are over-the-counter mouth guards you can buy, will not be custom fitted. This may work for the occasional teeth grinders and are probably the most inexpensive mouth guards. And there are mouth guards called boil and bite. With this type, you just boil the appliance in water, bite into it, and in that way you make your own impression. It's usually quite simple to do, and seems to be the most common type out there. They are night guards you can order online from a company. You send them your impression, and then they will send back your fitted mouthpiece. The fitting made from the lab is the best one, in my opinion, because it's the most accurate fit, but you need to see your dentist for the impression. If you suspect you may suffer from bruxism, don't worry. As you just heard, it can be easily treated with night guards. However, It is always a good idea to see a doctor to see if he or she can discover the root cause and fix that before seeking other treatments. In some cases, sleep apnea can be the cause, actually. I hope this information will help you to a better sleep, and by choosing the right appliance, you may provide a guard to your teeth and to your head and neck muscles. Bye bye and sleep well.